Hey everyone, welcome. My name is Angela Love-Zaranka and I am with Lactation Education Resources.
Yes, hello, I'm Sekeita Lewis-Johnson, and I too am with LER.
So I am the program director for LER. Sekeita is our accredited provider program director, and we're going to take a little bit of time and we are going to talk about the reality. We're going to give you a little real talk and the realities of being and becoming an IBCLC, but a little bit of housekeeping first. So if you would like to ask us a question or if you'd like to comment, take a look in the GoToWebinar platform. It's really easy. You'll notice here the blue arrow is pointing towards the spot where you can ask questions. Just notice the blue arrow in that little circle in the drop-down platform. Go ahead and give it a try if you'd like. You can tap on that and you can type in, for example, where you are participating today. We'd love to know where in the world you are located. Now, if you're participating today from your mobile device, then take a look at the green arrow, which is pointing towards the question button at the bottom of the GoToWebinar platform. If you'd like to, again, ask a question or make a comment, feel free to do so. So joining our webinar today to support the webinar, we've got Julie Grimes, who's from our amazing customer support team. Julie is also an IBCLC and can answer your questions in the chat, the questions that you ask, or she's gonna flag a couple of them so that at the end of the presentation, we'll be able to answer them live. Now, if you're having any issues, any sort of tech issues, Jill is here on our call providing tech support. So if there's anything that you need from a tech perspective or just a general question, please feel free to ask us and we will provide you with the answer as soon as we can. So let's dive in and take a closer look at what a lactation consultant is and how you can follow your passion and become one. If you decide to become an IBCLC, you will join more than actually 37,000 IBCLCs in over 130 countries and territories. Credentialing as a lactation consultant is offered by the International Board of Lactation Consultant Commission. Take a look at their website, which is ibclc-commission.org. They have different regional offices depending on where in the world you reside or work. Review the requirements and pathways to become eligible to take the IBCLC exam. What do you need to know? The detailed content outline, which is also known as the exam blueprint, is based on surveys of IBCLCs in various practice settings around the globe. The outline covers all of the topic areas and the chronological stages an IBCLC needs to know in their work. LER's courses cover the entire detailed content outline, and our courses are approved by LARC. That stands for the Lactation Education Accreditation and Approval Review Committee, which is why the nickname is LARC. That's the organization that evaluates and approves lactation consultants training courses. So Sekeita is going to review a few questions that you may want to ask yourself today as we get started. Sekeita?
Yes, thank you, Angela. Before you go, can you please share a little bit about yourself in this lactation world? So what makes us be able to sit here and talk about the real realities of being and becoming an IBCLC?
Thank you. I did skip over that, didn't I? So I am a lactation consultant. I started out working in the community, working in peer support, and then became board certified. I've been board certified for many years. I'll just leave it there. And have been doing this work for quite some time. I've done private practice. I've done community support. I've also worked in a hospital for over 20 years, dealt with baby friendly. And currently I am working as the program director, and I'm also sitting on a few different boards of directors, those that set the standards for IBCLCs. How about you, Sekeita?
Thank you. Thanks for asking. So I am the Accredited Provider Program Director, which is, it used to be called Nurse Planner, Lead Nurse Planner. So that is over accreditation, all things accreditation for LER. I came into maternal child health as a registered nurse, and I've been a lactation consultant for over 15 years. providing care inside the hospital, private practice, and community as well. Angela and I also share a lot of our background, whereas I have also too been at a baby-friendly hospital. So I am just glad to be here and to share some of the realities and realness of, my experience and the experience I bring to the table, and why I'm so passionate about some of the reasons and the real things about becoming an IBCLC. So thank you. So now that you know a little bit about myself and you know a little bit about Angela, we're going to begin with some questions that you can ask yourself today. Before we dive in, it might be helpful for you to write these questions down. And the first question is basically, do you have the skills that we're going to talk about, right? And before you get all like, whoa, well, that's why I'm here, I want to know, you know what? This is just thought-provoking reflection questions to be able to ask yourself, because truly in realities, this is serious business. I know when we're oftentimes talking about breastfeeding and chest feeding, we're all like romanticizing it. Oh, you can do this, anybody can. And it's like, yes, and this is real business, crucial business. Our families out here need us to know what we're doing when they seek us for assistance, right? So if you don't have the skills, the second question is, where will I get these skills, right? And so these are things to reflect on later, to journal about, to write about, because you really want to make sure that you are getting a comprehensive view and knowledge and skill set of becoming an IBCLC and what that means. So we're going to talk about some of that. So what makes an IBCLC? At the top of the list is competency. At the top of the list is competency. Competency means that you have the ability, the skills, and the knowledge to do a task and to do it successfully, all right? Really, in a nutshell, we're saying that you come with entry-level knowledge to do no harm. So how do you become competent? You become competent by maximizing all opportunities to get the necessary skills that are required for entry-level practice. And what I mean about that is everyone starts off in their profession as a novice, right? But it is expected that after you've got at least about 5 years under your belt as whatever in that profession, that you're moving towards a more of an expert field, which means you continue to seek out learning opportunities. You continue to add to your skill set so that when you get these, we're going to talk about acuity, but when you get harder cases, you know the knowledge and the framework to pull from basically your skill set, and you will recognize, okay, I've never seen that before, but let me go to my resources, let me go to my tools, let me go to my tricks. And so competency also means, for example, and I want to say this because this has been weighing heavily on my mind, and I don't think I've ever said this before in a live, but sometimes we tack on credentials and we think about, we add, for example, and I'm going to use RN because I am an RN. So sometimes we say RN IBCLC. I want to make it really clear that just because you have another title, that doesn't mean you're more competent than someone who is an IBCLC, right? We are talking about having the ability, the knowledge, and the skill set to do it successfully. And I can speak for RNs across this in the United States, that is that clinical management of lactation is not built into the curriculum. And so where do you become competent, right? You become competent by getting the necessary skills related to clinical management of lactation. And so that's what competency is all about. At the end of your training, you want to be confident that you are doing no harm. And that is the reason why competency is so crucial to what we do as IBCLCs. Credible care and culturally appropriate care. Let's really think about what culturally appropriate means, or culturally competency means. If you worked in healthcare or around anyone that's been in any business sectors, some of the words you might hear is culturally competent. And, you know, there's other words, cultural humility. Really, what we need to be clear on is that we don't feed into stereotypes when we're talking about what's culturally appropriate for someone. It means that we are taking a step back and we're analyzing our own sets of belief. We're analyzing, we're doing a self-reflection and self-critique where we learn about our own culture before we really start to think and examine other people's cultures in their cultural identities. And so tying in cultural humility, which is what I just talked about, it is a lifelong process of self-reflection and self-critique, whereby the individual not only learns about another culture, but starts with an examination of our own beliefs and cultural identities. And that's the definition given by the National Institute of Health. You can find other definitions regarding cultural humility, but in a nutshell, what it really is talking about is really defining for ourselves how we see ourselves in relation to humanity and the humanity and experience of others and what their belief systems are. So, you know, one of the things that strikes me sometimes when we're talking about lactation and we're talking about anything, we might hear people say things like, oh, this culture, they don't believe in that, or they don't do that. And one of the things about cultural humility is, like I said, not feeding into types and not making assumptions about what someone will or won't do based on their culture, because we really don't know, right? Unless you've been told by that individual that, hey, in my culture, because you know we have subcultures within cultures, right? And you know, this is what I value. This is what I would like to do. This is what I see myself doing. So really thinking about it from that lens. Credibility. Are you a credible source? Are you a credible resource? When you're asked about something and you don't know the answer, how do you respond, right? Do you try to go off your whim of your lived experience, or do you sit for a moment, think about what's been asked, and then answer the question based on the evidence, not based on your story, right? And I'm asking that question because every single time someone says that they're going to be breastfeeding or chest feeding, you hear other people's stories. So, you know, some people are like, oh, that really hurt me, or it didn't really hurt, or da 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 da. You have to listen to some of what people's experiences are. And I'm not saying that you can't reflect on your own experience, but as a clinician, you want to rely solely on the evidence. And evidence can be different. Evidence can look different. So I'm not just talking about random control trials and qualitative and quantitative data. No, evidence can look different, but I just want to make sure that you're being credible, which means that you're giving out information that coincides with the best evidence and that you really know what you're talking about, right? The question then becomes, do you know what the evidence says? And if you don't know what the evidence says, do you know where to find it, right? We're not all walking dictionaries and walking computers, and it's virtually really impossible to know everything. So demonstrating credibility is about being forthcoming. You know, it's about saying, you know what, I'm not quite sure about that. Let me get back to you, and then go back and check your credible resources and get back to the client in a timely manner. Credibility is everything. If you lose credibility as a lactation consultant or as a lactation supporter, it could translate to other IBCLCs in the profession losing credibility. And so you really want to be careful to protect the integrity of the credential. Policy advisor, creator, and advocate. These are topics that go hand in hand. As lactation consultants, as IBCLCs, yes, we do actually help create policies, and that's important to know from the standpoint of talking about clinical care. So remember, I asked, you know, do you have the skills necessary, right? Some people on this call may already have strong skills and policies, right? And if that's you, I'm like, yep, please come on, we need you. There's lots of policies that are still yet, you know, on your local levels, on the national scene, on the international scene, we need you. So language and policies matter because poorly written policies can end up with unintended negative consequences. And that's why it's that's why it's important to have a strong policy background and to have people in the profession that have a strong policy background. So if policy is your thing, you already have that piece, absolutely. But let's just say policy is not your thing. What it is then is we become stakeholders, right? That is how we are still in the policy realm. It is another form of policy work. So IBCLCs are stakeholders. So we should be at the table whenever lactation specific or related policies are being discussed. And so keep that in mind, because really and truly, however policies are created, they impact us. And then that then informs our advocacy. And advocacy is such a huge part of what we do and who we are. An advocate is simply just a person who supports publicly, who supports or recommends a cause or policy. So even if you're not a policy advisor, you can be that person at the table listening to how policies are being created and share your perspective from your practice and your experience. Problem solver and researcher, sometimes they are one and the same, and sometimes they're different. But being a problem solver is about 90% of what we do, because each family has their own set of circumstances and concerns. And really, when we're called for support, it's usually in request to some type of problem or issue, right? So be mindful about framing lactation concerns from a one-size-fits-all framework. Please know that one size never fits all. We should really be looking at the individual and what their needs are and what they've identified as their concerns as well as their values. So along with problem solving, remember I said you have to sometimes go back and say, I don't really know the answer to this, and I need to go and look that up. Well, that's being a researcher, right? There are two ways to be a researcher. You can be the person who carries out academic or scientific research, or you can be the person whose job involves discovering or verifying information. And that's all of us. You know, like I said, we're not walking around with everything in our head. We have to have valid and reliable tools that inform our practice. So I alluded a little bit to this earlier. High-level lactation care, skilled high-level lactation care. These go hand in hand. When we talk about high-level lactation care, I am talking about cases that set a clinician apart from doing the basic, most minimal lactation care, meaning uncomplicated lactation care, common problems. So for example, a common problem in lactation in the first few days after delivering may be a topic like engorgement. Like, should you know how to answer the questions about engorgement and how to manage engorgement as an entry-level provider and clinician? Yeah, you should, right? Should you know how to support someone who's had evacuation of a hematoma in their brain and they are intubated and on life support and on all different types of medications? You probably won't know that, right? That is not entry level. So when I talk about high level, and I just gave you a really, really tough case, but I gave you that case. It is not unlikely because that was my case. So that is what I mean is, as an IBCLC, you should be able to not only manage the level one, and I'm referencing the lactation acuity framework. So if you are not familiar with that, please become familiar with that. But I just gave you a level 3 when I talked about evacuation of a hematoma of the brain. And that means that there was a clot on the brain and they opened up the brain and they took the clot out, right? But are you able to do that? Or are you able to say, whoa, this looks different than the average case. Let me go back to my resources. Let me go back to when they talked about the brain and when they talked about medications. Let me go back to those resources so I can know how to make this all make sense. I know how to make those connections. And that is truly what I mean about skilled, is that you know how to make the connections when there's something in the clinical picture that's different from the normal a course of lactation, right? So when you're doing your training and you're like, why do I need to know about the brain? You need to know about the brain because it is that level of care that sets the IBCLC apart. Being able to handle complex clinical cases with sound clinical decision making and recommendations that are appropriate for higher acuity levels of care. All right. So I'm going to tell you right off the bat that is not the expectation as an entry level provider. However, that is the standard that as an IBCLC, you are able to identify when the acuity levels change and when you need to adjust your management and clinical decision making. Essential and timely care. One of the things we found out during the pandemic was that essential was a buzzword. It became a new buzzword. And we found out that yes, lactation consultants are essential because during that time, babies were still being born, families were still needing support, and they were needing support more than ever because they were being discharged home at a faster rate than they had been previously, right? And so basically, being able to promote and protect the ability during crisis to provide human milk is critically important. And not talking about just from the bonding standpoint, but we're also talking about, particularly during the pandemic, from a public health and prevention standpoint. So, yes, we are essential. It's important that we show up when families need us, that we are timely, that we can't say to folks, it would have been not prudent to say to someone, we're in a pandemic now. So when this pandemic is over, I'll come and see you. But right now you're on your own. No, we are frontline workers. And so I just want to make that real clear that, sometimes we walk into this space and thinking, yes, telehealth is on the boom. It is a big deal. It is a game changer. It has changed lots of lives in the lactation realm. And I would say yes, and yes, it has. But telehealth is not the end all to be all. Sometimes it prohibits our abilities to use other senses, right? And so we want to be real clear that sometimes supporting families in person is what families value and what they need, and that we are essential. And so when they call us, we have to be timely because if we say, oh, I can get you in 2 weeks from now, what do you think is going to happen to that feeding relationship? So we are essential, and it is our prudent duty to show up so that we minimize harms, costs to families, that we are accessible, because that is what becoming an IBCLC is all about. It is providing accessible care at the time that it is needed. Being a trusted collaborative care partner. What this assumes is that you are in collaboration with your client. You are not the center. You are not the decision maker. You are not even the expert. The families truly are the experts on their needs, right? Remember, it's their goals, their partner's goals, and their fears, as well as their barriers, that takes precedence over your goals for them. So, we know that the recommendations, worldwide, global recommendations, exclusive breastfeeding for chest feeding for the first 6 months, at least, right? We know those things. And it's important that we honor them, we acknowledge them, we educate on them, and we talk about them. However, we also have to understand that when we walk into certain clinical partnerships, we're collaborating in agreement that when someone seeks our care and they say, Sekeita, I'm only doing this for 3 months, it's important that I educate, but it's also important that I understand and I honor and that I don't step over boundaries that are not meant for me to overstep. That's how you become trusted. That's how you become trusted to do no harm, to be reliable, trusted to say, I see you as a person. I see that we're in this together. There is no hierarchy. We're collaborating to do what is best for you. on the contrast. When you go into certain clinical situations and you assume a hierarchy and you go in like, yep, I'm the expert. I've been teaching this for 15 to 20 years. Let me show you. I'm going to tell you how this works. Right off the bat, you probably will lose. You will lose that trust. People will shut down. People know when you walk in with a spiel and your spiel is the same because it becomes a rehearsed thing. And people know when you're not treating them on the individual level. Or what about when you go in and you just touch someone without assistance, without asking permission? You know, if they say I need latch assistance and you just assume that they want you touching them and their babies, you always want to make sure that you are collaborating because you're there as a collaborative person and not as the actual expert of that case. You both bring something to the table. In a nutshell, all of the topics that I just talked about is the framework for patient-centered care. And patient-centered care means that you are providing care that is respectful and responsive to the individual patient preferences, needs, and values, and ensuring that the patient values guide all clinical decision-making. So I've talked about culture, I've talked about collaboration, I've talked about communication, right? All of these things, I've talked about the level of care. All of these things are important, but what's most important is the person and the family in the center of that care. And so don't let person-centered care become a buzzword. Really think about these principles as it relates to our profession and how we how we help families when they seek our care. Actually really use this framework to guide you in your practice in becoming an IBCLC. All right, so I started off with some questions. I'm going to end with some questions to ask yourself today. These are also questions that are reflective questions for you to think about, because when Angela starts to talk, she's going to talk about the pathways. What you want to ask yourself is, what pathway is most appropriate for you? Sometimes when I finish speaking, people are already in the comments asking questions about the pathway, and Angela hasn't even gone over the pathways yet. Really listen to the presentation, what Angela is saying. Think about what your local market looks like in your area for IBCLCs. Think about how the number of clinical hours and the training fits into your lifestyle, and other things that you might want to consider before you start this journey. What are your current commitments, job, family, and school? You know, what does the market look like? What does mentorship look like in your area? You know, what are the requirements for you, and what does private practice look like in your area? Lots of questions to ask yourself today. So think about these things, journal on them. Angela, take it away.
Thanks so much, Sekeita. Appreciate it. Always good questions to ask yourself. Okay, so now we're going to talk about the pathways. And it may seem a little overwhelming, but I'm going to break it down into the 4 different components here and give you a bit of a roadmap. We're going to touch on each one of these, but as you listen, know that you don't have to go out and find each one of these different components. We are here to help you every step of the way. So, first thing you're going to need to do is to choose a pathway. We're going to come back to this in just a minute. Now, each pathway has 3 components. They include education, clinical hours, and getting ready for the exam. Okay, so the first one is the health sciences education. In education, there are 2 different pieces to it. There's the health sciences education and there's the lactation education. So first, the health sciences education, it's the typical education for healthcare providers. There are 8 post-secondary or university level courses and 6 general education subjects. You can find a full list for each of the 14 subjects on the IBCLC Commission's website. You can search for it, or you can find the link in your resource document in the handout in the GoToWebinar platform. Now, the 8 university level courses are, and you don't need to write these down now, biology, anatomy, physiology, infant and child growth and development, introduction to clinical research, nutrition, psychology or counseling skills or communication skills, and finally, sociology or cultural sensitivity or cultural anthropology. They can be online or in person, as long as the institution is accredited to provide the learning. Now, if you took those courses a few years ago, they count. Even if it was 20 years ago, those courses are going to count towards this requirement. LER has an amazing partnership with Walden University to provide these basic courses. Walden is online and they've chosen the courses to best fit the Commission's requirements. We are collaborating with Walden to provide our students with the deep discounts for the college courses. You can find the link to Walden on our website. Start at the top in the banner with training options, then click on I want to be an IBCLC, and then education, and you're going to find the link there. Now, the 6 general education subjects are medical documentation, medical terminology, occupational safety and security for health professionals, professional ethics for health professionals, universal safety precautions and infection control, and basic life support. 5 of the 6 general ed courses can be taken through LER. The only one you're going to need to search for is basic life support. In many countries, there is an in-person skills check for this training. Now, I have heard of some organizations providing this training completely online, so it's important to check your local resources. The guide, the IBLCE guide, provides general descriptions for the typical courses in this subject area. Please keep in mind that the IBCLC is international. The names used in their document to describe the courses may not exactly fit the description of the course at your accredited educational institution. That's okay. You're going to note these broad terms with the understanding that there is no one universal description for what a course in, say, clinical research is going to cover. Why are these 14 courses required? Remember that the IBCLC is a standalone credential, meaning you do not need another certification, degree, or license to practice as an IBCLC. Once you pass the exam, you will be an allied healthcare professional. The courses will help you to be prepared for your career as well as to help you pass the exam. Now, the second thing you need is this lactation-specific education. This is where LER has got you covered. The education should be comprehensive and cover the detailed content outline. The Commission requires at least 90 hours of lactation education, 5 hours on communication skills. Our 5-hour course is specific to lactation and breastfeeding care to help you in your practice as a lactation consultant, and 2 hours on the International Code of the Marketing of Breast Milk Substitutes, also known as the WHO code. We have just updated our course and it is very relevant to your work as an IBCLC. All of this is included in the lactation education that LER offers. So the third thing that you need is lactation-specific clinical experience. This can include in-person consultations, telephone consultations, or online breastfeeding and lactation care that supports breastfeeding families. It also includes lactation assistance to pregnant and breastfeeding clients and lactation education to families and/or professionals. These hours are to be obtained within the 5 years immediately prior to applying for the exam. How many hours do you need? Well, that depends on your pathway. So as I said, these clinical hours need to be accrued in the 5 years prior to applying for the exam. So here's a quick overview. I'll review more in the following slides, but this is the big picture. Pathway 1 is for healthcare professionals and those who provide breastfeeding support through an IBLCE recognized breastfeeding support counselor organization. Healthcare professionals include, according to IBLCE, physicians, nurses, midwives, dietitians, physical therapists or physiotherapists, speech pathologists, and others. Breastfeeding support counselors include those accredited through organizations such as Lactation Education Resources, La Leche League International, and the Australian Breastfeeding Association. Now, Pathway 2 applicants, they must complete a comprehensive academic program in human lactation and breastfeeding through an accredited university program. Their education has both didactic and clinical components, and they require 300 supervised hours working with breastfeeding families. So Pathway 3 is a structured mentorship program between the IBCLC and the applicant. The IBCLC, or if there's more than one, all IBCLCs must be in good standing with IBLCE. Now, those who choose Pathway 3 must have their program pre-approved by IBLCE prior to beginning to accrue their clinical hours. So just a quick note, for those of you who have breastfed or chest fed or provided human milk for your baby, the hours you spent nursing, pumping, and helping your friends sadly doesn't count towards your clinical hours. While 500 or 1,000 hours seems like a lot, there's a really good reason why. Each candidate needs to have the clinical experience so they can provide competent care as an IBCLC. Candidates who are applying for the IBLCE exam through Pathway 1 need at least 1,000 hours. So we're going to review Pathway 1. For the candidates who are also a healthcare provider, the hours can be done in a hospital, birth center, clinic, lactation care clinic or practice, or through independent practice as a licensed or registered healthcare professional in a non-healthcare setting. For breastfeeding support counselors from an IBLCE recognized organization, their hours can be earned in person or online. The location and type of support depends on the criteria provided by the recognized organization. The hours need to be counted on an hour-by-hour basis. Now, 2 important points about the clinical hours. It's important for you to document the hours as you accrue them. Be very detailed in case IBLCE chooses to audit your application to take the exam. They may want to see documentation, such as a spreadsheet or another document where you counted your hours. The other point to remember is that the 1,000 hours do not need to be directly supervised. Note that LER has a program for those of you who are not already affiliated with a breastfeeding support organization. The LER Hours program offers a way to gather those 1,000 hours in your community as a certified breastfeeding specialist. So now let's take a look at Pathway 3. That requires 500 hours of clinical experience. It is best done in a busy practice setting where you can work with many breastfeeding, chest feeding people, and those providing human milk to their babies each day, such as a hospital or clinic setting. The hours count towards the 500 only when you're actually working with families. Observation hours do not count. Remember that clinical experience is graduated. That is, it starts with observation, then doing tasks under supervision, then completing tasks independently with the IBCLC nearby to ask questions and discuss situations. We have an internship program with many sites around the United States. Reach out to support at lactationtraining.com and we can connect you with our clinical internship director, Amy Black, to determine if we have a site in your area. If not, we can give you suggestions on how you can work with your local hospital to facilitate an internship site. Now, one thing Amy wanted me to mention today is that you can't start to count your hours towards the internship requirement until both you and the IBCLC are comfortable with you working independently. Most interns spend about 75 hours in orientation before you can begin to accrue the 500 hours. Or you can take a look in your community to find a willing internship site or mentors. You may need to reach out to several people to find someone with the time, experience, and capacity to agree to be your mentor. It's important to find a good fit. Talk to others who've been through Pathway 3 to find successful strategies with finding a good mentor. Now, while this pathway has an additional step or 2, some people ask, is it worth it? The answer is yes. And why? Well, IBLCE reports that students who come through Pathway 3 score best on the exam. I think it's that mentorship piece that is the key component. Learning from an experienced clinician is well worth the extra effort involved at the beginning of this pathway. Now, a lot of people are asking whether or not they can accrue clinical hours via telehealth during the pandemic. The quick answer is yes. The longer answer is paraphrased from IBLCE documents. They will allow the use of technology if certain parameters are met. You'll need to pay special attention to privacy rules in your community and the Code of Professional Conduct, as well as the clinical competencies for IBCLCs. Now, education, the lactation-specific education. We have two ways to gather your education hours. One is our Lactation Consultant Training Program, which is the full 95 hours front to back. The other is either core or our bridge course. They are designed to meet your education needs depending on your background and previous lactation training. Now, here's a secret. If you're listening to us live today, which is December of 2024, we are currently having a sale on our most popular courses. I'm going to come back to that in just a minute. So first, our comprehensive course, Lactation Consultant Training Program. The LCTP is a 90+ hour course, which is eligible for CERPS, CME, and nursing contact hours. It's intended for those who do not have any lactation in education and they know they want to be an IBCLC. We have more than 35 of the most knowledgeable, experienced instructors who are practicing lactation consultants, researchers, and authors who teach in our courses, including Sekeita and me. Our classes are economical. You can view them on a variety of devices, such as your computer, tablet, or phone. They're optimized for a computer, but they can be reviewed later when you're on the go. We've been educating people in person and online since 1990. We update our course information with the latest peer-reviewed evidence on a regular schedule, but we will update sooner as new evidence emerges. Have a question for the instructor? You can send an email to our support forum, and we have IBCLCs available to answer your questions. Upon completion of the 95-hour course, you're eligible to take the Certified Breastfeeding Specialist exam. The exam is included in the price. Once you pass, you are a Certified Breastfeeding Specialist. This is to recognize you for the level of education you have attained. With this certification, you can begin to collect your clinical hours towards the IBCLC exam. Now, if you're unsure where to start, or you already have some lactation-specific education hours, then we have our core or bridge programs to meet your needs. They have the same advantages as the 95-hour LCTP course. Our initial course is called Core because it will provide you with the core lactation education you need to understand what it means to begin supporting the normal course of breastfeeding. It is 52+ hours of online education. It covers the basics such as anatomy and physiology of lactation, infant growth and development, supporting the preterm baby, medications and breastfeeding, and many more. At the end of the course is a Certified Breastfeeding Specialist exam. Now, our bridge course is ideal for people who have the basic lactation education components and they need an additional 45 hours to qualify for the IBLCE exam. Topics in our bridge course include legal and ethical concerns for lactation consultants, infant feeding in disasters, breastfeeding the infant with medical challenges, case studies, and clinical skills videos. If you're not sure where to start, well, if you're new to the profession, I would suggest the core course. And as I mentioned, for those of you who are listening live, I'm happy to mention that we currently have our biggest sale of the year for the 95+ hour LCTP, our core, and our bridge courses. You can take 15% off of any one of these 3 courses. Head to lactationtraining.com and choose the course that fits your need. Now, you are going to have to act quickly. The sale ends December the 6th, 2024 at 11:59 p.m. Eastern Standard Time. So be aware. Now, I know that these requirements seem like a lot, but we are here for you every step of the way. If you have questions about the pathways that don't get answered today, please be sure to reach out to our friendly customer support department. Many of our team are IBCLCs, and they know the process inside and out. LER has 3 ways for you to earn your education, depending on your goals and where you are right now in the process. If you have questions about what would be right for you, again, our customer support team is here to help. Now, if you're not a healthcare professional working directly with families, getting those hours can feel like a challenge. We have two programs, one for Pathway 1, our hours program, and one for Pathway 3 students to get that clinical internship placement. And when you're ready to take the exam, LER has you covered here as well. We offer two versions of our very popular exam prep. Both use our LER QBank system, which is a comprehensive system including practice exams, photo flashcards, anatomy flashcards, a study schedule, and more. For those who take our 95-hour course, we include a discount on our exam prep course. Now, our 90-hour course, as well as Core and Bridge, are available in Spanish. Capacitación en Lactancia is our website, which provides the same high-quality education found on LER in Spanish. Now, here at LER, we believe that access to high-quality lactation education should not be limited to those who live in countries with high incomes. We recognize that in many parts of the world, the relative purchasing power of a local currency may make the cost of lactation education inaccessible. As part of LER's commitment to increasing access to lactation training worldwide, our pricing is adjusted according to the student's country of residence. In alignment with our continued commitment to diversity, LER is proud to announce our Rising Tide Lactation Equity Scholarship Program, designed to increase the number of Black and Latinx and Hispanic IBCLCs in the United States. We recognize the greatest obstacle to entry into the field is access, specifically demonstrated by financial barriers. LER will remove that barrier for Rising Tide Scholarship awardees. Now, we alternate these scholarships each year. In 2025, we will host our Juntos Triunfamos Scholarship. You can find out more information on our website, lactationtraining.com/Rising Tide. Our team is here to help you now and in the future. We have tech support open 7 days a week. You can get your questions answered about our content by those experts in the field, and we provide ongoing support for the next step in your career. For example, someone actually reaches out to us on a relatively regular basis, and they need some sort of support, either working directly with a client or to create policies for their facilities or for advocacy in general. And indeed, those questions come into the support forum. Actually, we've had people who call us and we actually answer our phone. That many people are surprised by. Wow, you guys answer the phone? We do answer the phone. And if Julie happens to be the person who answers the phone or someone else on our team, then we will do what we can in order to advocate and in order to find some of the resources that you need and make the connections. Thank you very much for your time today. Okay, Sekeita, so do we have any questions today for Julie?
Well, Julie has been so amazing and so wonderful and answered all of the questions. And there's just a quiet audience. And so I do want to ask if there's any questions, please feel free to pop the questions in the chat. If there's anything that you are unclear about or something that we said that you're like, oh, wait, can you re-explain that? Please ask. Now is the time. We do this live so that we can give you the best knowledge that we have, at the time of your question. So yeah, but this is a quiet audience.
So one question that we're often asked is, do you need to have some other sort of, healthcare background or license or credential in order to practice as a lactation consultant? And, Sekeita and I presenting this content today is quite intentional for a variety of reasons. And one of them is the fact that I have worked for over 30 years providing lactation support and clinical care, and I work exclusively as an IBCLC. And so, indeed, you can do this work, but that's also a reason why you need to ask those questions in your community. Sometimes people will ask, well, how much can I make as a lactation consultant? And frankly, that depends on where you live. In some areas, you can make a living wage, and in other areas, not so much. And to those people who are practicing in other parts of the world, the landscape is even, more nuanced. depending upon where in the world you happen to work and live. So those questions about the sustainability of being a lactation consultant are very important for you to ask yourself and to do a little bit of homework ahead of time.
Absolutely. Thank you, Angela. Another question that we get asked often is about mentorship. How do I find a mentor? Or, where can I find a mentor? One of the recommendations that I always say is become involved. If you're not involved in what's going on locally with your coalitions or anyone that's doing this work, you really want to become involved and you want to build relationship first. And I am seeing so many questions coming now that are flagged. So thank you for that. Thank you for asking your questions. But regards to mentorship, just know that you have to build relationship and you have to be clear on what it is you're asking of your mentor and what your needs are. And so hopefully if you're already involved in coalitions and you know some local IBCLCs and you have a relationship, I say that's wonderful. But sometimes it takes building those relationships first before establishing that relationship, that clinical relationship.
That's it. Okay, so the first question we have here is, and it just popped away because Julie's answering them.
Yeah,
so
if you
quickly.
take the 95+ hours pathway and pass the exam and become a CVS and you have your own and want to start offering lactation services in your own practice, do you have to get that practice credentialed first? So pathway, hours pathway, if it depends on what pathway you're taking. So if you are on pathway 1, then there's ways to get your hours to make the hours count. I believe that's what you're asking. How do
Yeah,
you
I'm wondering,
go ahead?
become a CVS and have your own, and so if you have your own practice working as a healthcare professional, or let's say you're a doula, and then you want to start offering lactation services, do you have to get that practice credential? So you may not have to get the practice credentialed necessarily, but you yourself need to have some sort of basic knowledge of lactation education. So becoming a CVS would be a way that you can provide those services to your community. And I do recommend that you get that training. One of my funny examples is let's say that you believe that in order to get a really effective latch, you have to stand on your head. The parent has to stand on their head. Well, but if that's not something which is supported in the evidence, then you're suggesting something which is not supported by the evidence and may actually cause harm and all sorts of other things, right? So you want to make sure that you've got that basic knowledge so that the information that you provide to your clients is something which is evidence-based, something which is tested, not just in the research, but also clinically as well. So that is, I think, that's my interpretation of that question. What do you think, Sekeita?
Yeah, go ahead, because I was having a little trouble with that one.
Yes, this person said, yes, I'm a doula. I'm sorry, I was trying to type fast. So thank you very much for providing that clarity. So yes, as a doula, and Sekeita, you're a doula. So do you want to address?
No, I just think that that's perfect. I mean, anything you can do to add to your skill set, particularly as a doula, I can definitely say my IBCLC skills come into practice all the time. I feel like I am one-stop shopping. So they don't have to go anywhere else. If I am their birth doula, then I am their lactation consultant as well. And I don't have to refer them out to anyone, unless there is a medical necessity of something that is out of my scope of practice. And so, yes, I will say that. There is another question, Angela. Would my EMT courses count for the other second group of classes?
So, yeah, go ahead.
I would like further clarification if you could, when you say other second group of classes, if you can clarify that question a little bit. I don't want to take a stab at it, but Angela, by all means, if you feel like you want to take a stab, please.
No, I'm just thinking that the other second group of classes would be like, universal safety precautions, as Julie is saying, occupational safety, things like that. those classes would count if you took them as an EMT. If you took anatomy and physiology at a university or a college, then that would count towards the hours that, the college courses that you would need. So yes, some of those courses would count. So hopefully this person will respond and clarify. I want to switch over to another question here, which says, I'm a postpartum RN, so I know Pathway 1 is the best choice for me. From Angela's presentation, it sounds like the bridge course will be a good option for the 95 required hours. Is that correct? Do I still need the 90 hours and 5 communication hours for education? I'm confused. Thank you so much for asking that question. So the 95 hours is the lactation consultant training program, the big course, LCTP. The bridge course is if you already have 54 hours of training. Like, let's say that you were already a CBS and then you decided you wanted to be an IBCLC. Well, the 54 hours, you need to add hours to that 54 hours in order to equal the 95 hours that you need. And so that's when we would recommend the bridge course. So if you don't have any lactation training, or frankly, if you have, some nurses will take the baby friendly training, anywhere from like 10 or 20 hours of training on baby friendly, and think that hours can apply towards your 95 hours. And while it can, the Baby Friendly Hospital Initiative is relatively narrow as far as the information that you need. Yes, anatomy and physiology is anatomy and physiology of lactation, and yet there's a lot more that you need to know in order to sit the IBCLC exam and to be a board certified lactation consultant. So in this situation, I would say that if you don't have any lactation education or very little lactation specific education, I would recommend the lactation consultant training program, which is the 95-hour course.
Yeah, I do want to just tack on a little bit to that, Angela.
Please.
As a nurse, I heard about the Pathway 1. I want to be clear that as a healthcare professional, you can do Pathway 1 or 3. I did Pathway 3 because I wanted the clinical hours. I wanted the actual practice with other IBCLCs to really hone my skills. And so I wanted to just talk about that. It's funny because someone reached out to me and said, hey, can you come and be on our panel? Because you did Pathway 1 and you're doing so great. And I'm like, no, I did not do Pathway 1. I did Pathway 3.
That's right.
And so with that being said, I just wanted to make it clear that you can still be a licensed professional and choose a different pathway. That's all.
Well, and that connects, that's really a good point to this next question here, which, do we connect students to mentorship? And so the questions that you were just, if you want to repeat those questions, Sekeita, how can you find a mentorship program? And yes, LER does have an internship program.
So we do have an internship program that Angela spoke about. A lot of times, sometimes it is getting into that program and finding a program that's near you. What I say when you're seeking out a mentor is you're building a relationship with someone who has agreed to help you along the pathway. Some mentorships are informal and some mentorships are formal. And what's interesting is people will say, oh, Sekeita was my mentor. And I'm like, what? And that meant that they just taught me out one time and they asked me a question and I answered it and they were like, yes, right? However, building that's an informal relationship, right? But building a formal relationship in the sense of mentorship, sometimes there is some funds that is exchanged. You have to think about the amount of time that it takes to train another individual, to teach them from the very beginning of a consult to the end of a consult, which is the documentation and the follow-up thereof, right? And so there's lots of moving pieces. And so when you say mentorship, I want to make the assumption that you're talking about a formal mentorship, and having a formal mentorship means it's someone local near you so that you can get the experience of, and I've known people that have flown other places to get experiences with certain IBCLCs for a week or so, but it is really learning the ropes of managing, of the clinical management of lactation, right? And so it really depends on what you're looking for when you say mentorship.
Perfect, thank you. And yes, we actually do have, we're working on a new internship site in Kansas, actually like 3 of them. And indeed, if you want to go to Kansas and relocate for a couple of months and get your hours, then, you know, I know that that's something which is emerging. Someone is asking, can you schedule to take the exam when you're ready, once everything is complete, or is the exam only offered on pre-scheduled dates? It's a really good question. Sekeita, do you want to?
The exam is scheduled on pre-scheduled dates, and you have to actually apply to take the exam. And actually, the last date to apply to take the exam in April would be, I believe it's January 6th of 2025. And so with that being said, the dates are, it's usually a window of time for the dates, and it's offered twice a year. And so you want to be clear that you, whatever pathway that you have, that you actually have filled out your application, you know, you've cleared the process. They will send you something back letting you know whether or not you can test, and then so the process begins.
Yep, yep. And then the person who's the EMT said yes. They BLS and HIPAA, Universal, and things like that. They have an associate's in science, so the only class they may need is the nutrition class. Yeah, that makes perfect sense. So do take a look, as Julie's just popped in the chat, the IBCLC Commission's Health Sciences Education Guide, and then that way you can sort of compare and contrast and see. Someone is also asking, are the clinic hours approval in Rome, Georgia? So if you want to know more information about specific internship sites, which we have, and where they're already located, you would need to reach out to support@lactationtraining.com, and we'll connect you with Amy. Okay, good. I think that's it for today, Sekeita. So do make sure, everybody, that if you are thinking about taking this, if you are thinking about doing our 95-hour course or our 54-hour course or our 45-hour bridge course, please do sign up now while we've got our best discounts for the year. So 15% off on our website. So do navigate over, and really do appreciate all of you taking the time today to sit with us and to ask the questions. Thank you.
Absolutely. Thank you for joining, and good luck and best wishes on your journey to becoming an IBCLC.
Bye, everybody.
Bye.